Joining me now is Dr. Sachin Chitte, and he is a plastic surgeon with the Brockville MediSpa, which is by the Ottawa Derm and Surgery, and we're going to be talking about, well, lots of things. So let's talk with Dr. Chitte. So welcome to the program.
Well, thank you. Thank you very much for having me.
I'm looking forward to this interview.
Oh, good. I'm excited too.
Okay, so healthy skin.
Yes.
What should we be doing to ensure that we do have healthy skin?
So healthy skin is extremely important. It's the largest organ in the body, so you do absolutely have to take care of it. And there's a lot of things to do. I mean, the first thing to do is you should live a healthy lifestyle as best you can, right? So it's not about a specific, you have to do this, you have to do that specifically, but just, live a healthy lifestyle, eat well, exercise. Smoking is not the best thing for your skin, so if that's something that you do, it's something to give consideration to.
Yeah.
And then beyond that, then we start specific treatments and things you can do for the skin. So I think one of the most important things that I could bring across is sunscreen. The sun is awesome. We love the sun, and it does so much good for us.
Yes.
But the sun also has ultraviolet light in it, which again has a lot of benefits. It does a lot for us, but it also contributes to photoaging. So what it does is it breaks down some of the collagen and the elastin and some of the fibers in the skin that maintain tone and stop you from having like sagging skin. And it also can create skin cancers.
Oh, yes.
So there's a spectrum of normal skin to skin cancer, and as you get a little bit more sun exposure, you can get closer to that skin cancer stage.
Right.
But I think the really big thing is to wear sunscreen, and there's always a question like which sunscreen is the best, and the simplest answer is the best sunscreen is the sunscreen that you'll wear. They're not all created equal. What's good for one person may not be good for another. So you find something that you like and wear it and do that. Moisturization is big. So moisturizing your skin is really, really important, and this can be part of a morning routine. So I have a morning routine, and I'll be very honest, if I had like 12 steps, I probably wouldn't do it.
Yes.
And so I have a very simple 3-step routine. So in the Derm Center and here in the Brockville MediSpa, we have little kits that you can get that contain a cleanser, a toner, and a sunscreen.
Okay.
So that is one combination that you can use. With certain patients, it's not right for everybody, but retinols can be helpful too, which is a specific type of topical treatment that helps turn over cells and give you, more youthful skin. It's not right for everybody.
Right.
And then there are very, very specific products that you can get into, like certain vitamin serums and that sort of thing, where, all of this can help. So those are all things you can consider, but at its core, the really, really important thing is hydration, so moisturization, sunscreen. Really, really important to do that. And when you go out into the sun, nobody's saying don't go out in the sun, but when you do, just take some precautions. So wear a hat.
Yes.
Hats are really important.
Yes.
When you wear clothing, thin t-shirts, well, they're better than no t-shirts. They don't really have a high SPF. So if you're wearing a thin t-shirt, you may wish to consider putting some sunscreen underneath. Or there's clothing that's available that has built-in sunscreen, and that actually works really well.
True enough, yes. So I think one thing that is really important, and you've mentioned it, is the sunscreen.
Yeah.
And if people apply it first thing in the morning and then as needed throughout the day, because sometimes we forget, and even the sun, if the sun is not blaring,
that's right,
the clouds can move, and eventually the sun can come out.
And even through the clouds, there's still ultraviolet light transmission through the clouds. The general recommendation is every couple of hours you should reapply.
Yes.
And if it gets wet or you get sweaty, then you should consider doing it a little bit more frequently. And even in the winter, there's a lot of ultraviolet light in the winter, and sometimes it reflects off the snow and the ice, and then so you still get it even if you don't have that sun out. It's still there. When you're driving in your car, they're interesting. There's especially the left side versus the right side, and in Australia, the right side versus the left side.
Right.
This sort of thing.
Yes.
There's lots of studies that show that, so it's a real thing, and ultraviolet light's a real thing. So sunscreen, whatever you wear, whatever makes you comfortable, whatever you like, just wear it.
Just use it.
Just use it.
Yep. Okay. Let's talk about hooded eyelids.
Yes.
I have hooded eyelids. Can something be done?
Absolutely. So as you get older,
Yes.
we all lose tone in our skin. And what that causes, in many cases, is descent in the upper eyelids. It can cause hooding, and in some cases, you may have a genetic component to it. The simplest way and the really effective, predictable way of having a fantastic result is to actually remove some of that skin. So this is a surgery.
Okay.
Non-surgical interventions you can try if you have early skin excess. You might have a little bit of success with the non-surgical stuff.
Okay, like a topical or whatever.
Yeah, or there's some wands that we have that can help, but they tend to be temporary and they don't work when you have significant excess. So significant excess essentially involves taking out that skin.
Okay.
And in some patients, there's a little bit of fat behind that skin, and sometimes that bulges forward and contributes to like a puffy eye look, and sometimes you have to take out a little bit of the fat as well.
Oh, okay.
So surgery is done, it can be done under pure local anesthesia. We can give you a little bit of oral sedation, or if you want some intravenous sedation as well. It takes less than an hour. You come in, we just take out this skin plus or minus the fat. You have some stitches that come out after about a week.
Yes.
And the results are stark. For a lot of patients, they come in, and some patients like to wear eyeshadow and they can't because they've got the hooding.
Yes.
Or, you put mascara on it and it ends up on your eyebrows because of all of the hooding. Instantaneously, you see a difference. And with the protocols that we have, by a couple of months, the scar is hidden in the fold. So when your eyes are open, you don't even see the scar.
Okay.
And when you close your eyes, it heals so well that after a couple of months, you can't even see it.
Yeah.
Like, it's there, but it's really, really hard to see. Patients love it. I love it. It's my favorite surgery. Within less than an hour, you look refreshed, you look less tired, there's less weight on your eyes look wider and more open. Patients, they say they look happier. And it's one of those things where it makes a big difference, but when you go out, people notice. They don't necessarily know what you did, but they notice, and it's become a big thing, and it's a fantastic procedure. Fantastic procedure.
Oh, I really didn't realize that before. So it's not done in a hospital setting, it's done right at the spa.
So at this point in time, we're currently doing this in the Ottawa office right now. It's not done in a hospital. It doesn't have to be done in a hospital. Okay. In our current juncture, we're doing it in Ottawa.
Okay. And so the recovery for that would be?
So the first... Yeah, a couple of weeks. Generally, you do pretty well. So while you have the stitches in, the stitches that we use, especially non-dissolving ones, the ones that have to be taken out, usually have a color to them. Okay. So the ones that we use are blue. There are black ones too. So it's kind of hard to hide those. They're kind of there. So they're in for about 5 to 7 days, and then after that, it's possible you might get a bit of a black eye or something. So if you're front-facing, I generally tell patients a couple weeks, and you should be pretty good.
Okay, let's talk about Botox and fillers. What's the difference?
Great question, because they oftentimes get mixed up and used interchangeably, but they're quite different. So Botox is something that weakens muscles. And the way it's used is, the way you think about it is, when you contract a muscle, your skin is stuck to your muscles. And when you contract them, you kind of make this little valley. And that valley is a wrinkle. So if you think about it, if you didn't contract it as much or even at all, you shouldn't get that valley, so you shouldn't get that wrinkle. So what Botox does is it weakens the muscle, and the more you put in, the more it weakens it. So if you put in a little bit, instead of getting like a deep valley, maybe you get a little less of a valley. Okay. You put in more, then you can actually stop movement. So the idea behind Botox is to address what are called dynamic wrinkles, so wrinkles that happen with movement. It can also address fine lines. It's very good on the forehead, around the eyes, around the nose, and you can actually put it in other parts of the face as well, depending on what it is you're trying to address. Yes. And the key is to talk to your injector and try to explain what you want to do, because now, in the past there was a movement towards just kind of freezing the face. Yes. We don't do that much anymore. Everyone who's doing stuff now, most people just want a natural look, which I think looks great. So you just put in a little bit. You don't have to overdo it. And you can get a really nice relaxation of muscles. Like you do it on the forehead a lot for frowning. Put a little bit in, you can still frown, you can still be angry, you can still be surprised. But it's less, and it works really nicely. So Botox is something that weakens muscle. Okay. Filler is something that takes up space. So the question is, well, why would you use filler? And there's a good explanation. So the natural aging process, as we're starting to understand, results from losing volume. So there is what's considered to be called like a clockwise downward rotation of the face, and you lose volume. So you lose volume of fat, you lose volume of muscle, you lose volume in your skin, you lose tone in the skin. So the idea behind filler is that, well, we know that the descent in some of these static wrinkles. So these are wrinkles that don't change with movement. These are wrinkles that are just there because of the characteristics, the position of the skin.
Yeah.
If we try to replace the volume where it's lost, we can many times improve those wrinkles. So that's what filler is. Filler is to occupy space. And you can use filler when it's used for rejuvenation. You put it on, you typically start with the cheekbones, because as we start to understand more and more about aging, it seems that aging starts here.
Yeah.
So then if we put the volume back there, it may not fully address the other stuff, but it's remarkable, and patients are shocked. You put a little bit of filler up here, and again, it's all about putting in enough and not too much.
Right.
If you put in too much, you're going to look like you have filler.
Right.
But if you put in the right amount, in the right place, it can rejuvenate the face. It can open up your eyes. It can change what's called the light reflex, how the light shines in your eyes. It can make you look less tired, less angry, less all those things that you're not tired or you're not angry, but it's just your face may
skin,
portray that because of the skin. If you replace some of the lost volume, you can really create a lot of improvement. And that's really what filler is. So filler is something that occupies space. They're usually done together. They work synergistically, and each has its own role.
Yes.
But they're separate.
They're different.
Separate roles, yeah.
Thank you for explaiting that, because I was lost.
Oh no, for sure.
I was
and
lost.
you know, honestly, they're used interchangeably, but they work so well together. You just gotta, you figure out what it is, the goal, what your goal is, and then the two of them together usually just do a great job.
Fantastic. So if anyone is interested in connecting with you, it's the Brockville MediSpa, 613-342-0220. Thank you for sitting down with me. I really appreciate it.
Thank you.
And don't you go away. We're coming right back with more.